Tumor necrosis on MRI signal changes correlation. Introduction. Necrosis is most common morphological alteration found in tumors and surrounding normal tissues after radiation or chemotherapy. Pathology. Main possible pathological changes within the tumor and surrounding tissues likely. 1. Pure necrosis. 2. Cystic degeneration within the necrotic tissues. 3. Presence or absence of fatty changes. 4. Hemorrhage within the necrotic tumor tissue. MRI signal changes are varying above mentioned pathological changes. MRI changes. 1. Pure necrosis. T2 weighted images show high signal intensity but not as high as fluid. T1 weighted images show low signal intensity. Lack of contrast enhancement. Central location within the tumor. 2. Cystic degeneration within the necrotic tissues. T2 weighted images show very high signal intensity, as high as fluid signal intensity. T1 weighted images show low signal intensity. Lack of contrast enhancement. Lobulated morphology. 3. Presence or absence of fatty changes. In-phase and out-of-phase sequences correspond to paired MRI gradient echo sequences obtained. If presence of intravoxel fat. Subjective loss of signal on out-of-phase images relative to in-phase images. 4. Hemorrhage within the necrotic tumor tissue. T1 weighted images show high signal intensity. T2 weighted images show variable signal intensity. No contrast enhancement. Susceptibility weighted imaging show low signal intensity areas correspond to T1 weighted high signal areas.